So at 4 weeks, so this is, again, patients take the medication, the regimen for 12 or 16 weeks, and then once they stop the drugs, we look for recurrence of the virus, so for hepatitis C RNA to come back. And the first time point that's traditionally looked at is 4 weeks, or what's called SVR4. And so by that time point, we saw one relapse in a single patient. This was the same patient that obviously, and the only patient that had failure again when it was looked at 12 weeks after stopping therapy. So we saw an early relapse. That's maybe to contrast from any patient who might have broken through while on taking the drugs, and we didn't see that. So we didn't see any patients break through during therapy. We saw one failure, and that was a relapse that occurred by 4 weeks after stopping drug. So the rest of the patients remained suppressed at 4 weeks and 12 weeks after stopping the treatment regimen. And the traditional definition of a cure, if you will, if people use that term, I'm fairly comfortable using it. So if patients their hepatitis C RNA remains undetectable 3 months or 12 weeks after they stop taking the drugs, they're considered as an SVR12, which we think is synonymous with a cure. The chances of the virus coming back sometime after that are much less than 1%. Overall, it performed very well. This is, again, a very difficult to treat population. This was enriched for genotype 3 patients. 14 of the 23 patients were genotype 3. And genotype 3 has kind of emerged in the era of direct-acting antivirals for hepatitis C as maybe the toughest genotype to treat. When I say tough, we're still talking about cure rates or response rates that are in the 95% range, but they're not quite up in the 98-99% range, which we see with a lot of the other genotypes. So one, it was enriched for genotype 3, and then the vast majority of patients in this trial had resistance going in. In fact, most of them had resistance in NS5A, and a number had dual NS5A resistance, so relatively high level NS5A resistance, yet most were cured with therapy.